Burnout's become an increasingly important topic in 2017. As you know, you speak about it often. Our clinical volumes continue to increase, reimbursement declines, research dollars are becoming harder to find. And this has led to many stressing the importance of work-life balance, or as others have put it, work-life alignment. Can you please speak about how you balanced or aligned these issues when you were a junior faculty? And what advice would you give on this topic to current or future generations of radiologists confronting the same thing?
Well, I'd go back and expand on that a little. We spend more waking hours working than any other single activity. So it's important for us to enjoy what we do. So I often ask people, why do you get out of bed in the morning? Well, sure, you got to pay the rent, but why do you want to come to work? What are you thinking about when you drive in? Are you thinking, I'm going to see some great cases, I'm going to make some diagnoses, I'm going to help patients get better faster? Do you think, I've got some research projects going and I can't wait to see where the next dot's going to go? Do I think, teaching trainees, medical students, residents, or fellows, and seeing their eyes light up when they learn a new concept, does that really turn you on? Is that where you get joy? So asking them why they do what they do, why do they enjoy it, how do they get pleasure out of that? I think that's what job satisfaction is all about. Compensation is one component of job satisfaction because we do have to pay the rent, but it's really what we do on a day-to-day basis that brings us joy. And as long as we're enjoying what we're doing, really not worried about the other aspects. I think the problem we've gotten ourselves into is we're used to working at this level and we're used to getting this compensation. And as you said, that equation is changing. So those people who are very concerned about the compensation side, well, maybe they need to find a different job, one that emphasizes that. But if you think about enjoying what you're doing on a daily basis, I think we're all still going to be able to send our children to college. And when you compare radiology compensation with other disciplines, we're still much better off than many of them.
Was there a particular moment in your career trajectory, perhaps a specific mentor or a specific patient, maybe an external event in your personal life or externally, that you feel had a major influence on your eventual trajectory? And if you did have such an event, did you recognize it when it was happening?
Well, the last part is probably the easiest, no. Mm-hmm. But we're a product of our biographies, and I can think back in so many events that help shape who I am, what I did, where I went, how things worked out. I can remember being an intern and caring for a patient with congenital heart disease. He was an adult by that time. And he painted a picture for me. After he was discharged, he went home, he created this painting, and he brought it to me in the hospital, and I was touched by the effect I must have had on him, and realized the tremendous importance of the profession of medicine and our effects on people. And it made me be even more concerned about how I interacted with others, and especially our patients. I can remember working with Ron Castellino at Stanford and his emphasis on efficiency, and that was a big help. I remember Henry Kaplan, and Henry talked with me, and he spoke about the importance of the department rather than the individual. And I still remember he said, "Reed, when I go to the hospital and tell them something, I don't say, Henry Kaplan thinks this. I say, the entire Department of Radiology thinks this." It's more powerful. I think of John Dotman, always analytical and always thinking and always coming up with new ideas. And I was at the NIH. I used to walk with John when he had a meeting in some other part of the hospital because he'd just keep talking and coming up with ideas. And he was just a remarkable individual that I learned so much from.
When junior and mid-level faculty meet with you for their annual review, which I've done on occasion, you're notorious for asking them, where do you see yourself in 5 or 10 years? And I'm curious, why do you ask that question? What advantages does it give you, and what advantages does it give the faculty to understand the answer to that question?
Well, I'd like to know what makes people tick, what makes them happy, what gives them joy. Because I think if they enjoy what they're doing, they'll do a better job. So if I can understand what they like, I often ask them, why do they come to work in the morning? To try to get that same type of information. If I can understand where they want to go, what their ambition is, if I can help them do that in a way that also helps the department, we'll have a win-win. So I try to understand each of the faculty and try to work with them to accomplish mutual goals.
People look at your career and they look at it as a career of tremendous success. And I wonder if you always knew what you were going to be doing in 5 or 10 years.
No. I can tell you that I always enjoyed work, and as people talked with me about new opportunities, I always welcomed new challenges. I think that's part of enjoying work rather than doing the same old thing over and over again. So for me, new opportunities, new challenges were some of the things that kept me stimulated, kept me excited, kept me interested, made me enjoy work.
For the person who doesn't have an immediate answer to the question of where do you see yourself in 5 or 10 years, do you think that's a problem that they should put a lot of attention into, or is that something that comes naturally, organically?
I think they should think about it. And of course, that's one of the reasons to ask the question, is to get people to think about what it is that they enjoy and to seek out positions that will help them with that. Not everyone enjoys the difficult conversation. And if that's the case, probably shouldn't be in a leadership position. Other people enjoy gathering information, giving advice, being helpful, being an essential part of the team, but don't really want to be the person that has to make the difficult decision. You can't please all of the faculty, and trying to do that is a sure way to fail. So you have to make difficult decisions, realizing that some people are going to be unhappy with it. But you got to think, did I make this for the right reason?
So now I'm sitting on the other side of the table asking all the questions. So I'm going to ask you, where do you see yourself in 5 or 10 years?
Well, first of all, I hope my health holds out. I'm doing my best to try to live a healthy life because health determines what happens to all of us. And we've seen that in people we've lost at a far too young age. But assuming that's okay, I'm looking for more challenges. And serving as editor of Academic Radiology is a fascinating challenge. I'm already very excited about it and trying to make it better, trying to make it more efficient, trying to make it more user-friendly for the authors, for the reviewers, and make it more readable for the people who look at the journal. So that's a fun part. I'm not quite sure what role I'll play in the department. The job of chair has become too busy. So I will suggest very gently to the new chair that they might want to delegate more to others. And maybe I could play a role in that. There are many things that require work, require some degree of expertise, but aren't terribly innovative, shall we say. Faculty promotions would be one good example. They take a lot of time. They take more time than they used to. And yet we decide we want to promote someone. There's a lot of work to convince the medical school that they should agree with that decision. So things like that I might be able to be helpful to the new chair so that the new chair can spend more of their time worrying about the direction the department needs to take.
Mm-hmm. To sustain a successful career over a long period of time, no doubt requires continual renewal of the sources of motivation that got you started in the first place. How would you describe what motivated you in the beginning of your career, and have those motivations evolved over time?
Well, I think the simple answer is, how can you make a difference? You know, we sometimes talk about how is the world a better place because you were here? And if you ask yourself that question, sometimes I've said in faculty meetings, when your grandchildren say, "Matt, what was your job?" And you'll tell them that you interpreted radiographic images and their eyes glaze over and they lose interest. They might say, "But what did you do? How did you help people?" And medicine is a great profession because basically that's what we try to do. So how did you make a difference? That's one of the ways I think about it. And then the second way is, how did I help other people make a difference? Or how did I help them find their way in life? There have been actually quite a few faculty who were unhappy. And I said, go into private practice. And they did. And within a year, they called and said, can I come back? Realizing that they belonged in private or in academics, but hadn't quite realized that, and forcing them to take a job in private practice so they could experience both sides of their career options, I think helped them realize that they really belonged in academics. And I think I helped them along their careers in doing that, even though it might have been considered a little tough or a little cruel to tell them I had to leave.
Medicine sometimes gets a bad reputation. Long hours, coupled with intrusive information technology systems, a Byzantine payment system, seemingly unending bureaucratic oversight, and it continues to stymie the happiness of the people who work in this profession. In fact, many doctors tell their children or think to themselves, gee, I hope they don't go into medicine. What advice would you give those who are considering a career in medicine in general today, or radiology specifically?
You have to do what you enjoy. And when you think about the professions, medicine is still one of the best. Our goal is to help people. Law is an adversarial profession. It's the lawyer argues for his or her side. They don't seek truth. It's adversarial. Business, it seems to me that they honor those who made the most money. I think helping people is a much more honorable way to live our lives, and I think the far better profession. I think some of the frustrations that we deal with are things that we really need to work on to improve, because you're absolutely right. The electronic systems we're using, particularly the electronic health record, is far from helpful. It's a problem right now and needs to be improved.
So on balance, if one of your young family members were to come to you and say, do you think I should go into medicine? What would you tell them?
Great choice.